welcome back, everyone. You are listening to News Talk 1480 WHBC. It is our annual health week, and today we are at OMNI Orthopaedics. We were talking about total joint replacement, but we're going to kind of switch gears just a little bit here and talk with Dr. Brett Daly about sports medicine and some real interesting things. And Dr. Daly is with us right now, and maybe give us a little insight to your background, your history,
right.
How you got to this point.
Yeah, well, thanks for having me here, Pam. So my background is in sports medicine from the beginning. That's kind of what got me into orthopedic surgery, is playing sports growing up. Some of the injuries I suffered, I interacted with my local surgeon and followed that career path. And then I went on to play football at Ohio State, suffered some injuries there, and continued my training specializing in sports medicine. So I think that really helps me in my practice. I've been on both sides. I've been the injured athlete, and now I'm the treating physician, and I think that helps me have an understanding of the goals of the athlete and getting them back, and giving them some leeway on what they can and can't do, and trying to get them back on the field and playing as soon as possible.
I mean, what are you seeing most of these days? I mean, I know there are kids that play more than one sport, and
I think one of the biggest problems that I see these days is sports are very intense now. There's so much. It's not just, your little league baseball, your high school sports. Kids get into a sport now and they play it year round. Everyone thinks that they have to have their one sport and they have to train it year round to be the best at it and have a chance to go on and have a career in college. So we see a lot of overuse injuries where the body is just not getting the rest and recovery that it needs. For example, I see a lot of baseball players. I like to treat them, but a lot of times they're injuring their shoulders and their elbows because they're throwing year long. They might be playing summer baseball, going into fall ball, and pitching, and then in the winter when they should have their break, instead of doing that, they're working with pitching coaches and doing those things where it can really overstress a developing young arm and cause some issues that are otherwise preventable.
Yeah, so what do you say to them when they come in with an injury? I mean, because a lot of times they'll be like, but doctor, I can't stop.
Yeah, so one of the talks I have with them and their parents is letting them know that, trying other things will not prevent them from being a good baseball player, football player, soccer, whatever it is. I think becoming an overall good athlete is most important. And then one thing I stress is the best way to be a good athlete is to be present and be on the field. If you injure yourself in the process and you can't be on the field, then you're no good. So we really work at rehab. Sometimes we have to send them to work with our therapist to focus on mechanics and doing some things to help prevent these injuries and kind of take a step back.
Talk about shoulder injuries. I mean, what's the most common when it comes to shoulder injuries?
Shoulder injuries, it really depends on the age of the patient we're seeing and kind of the activities. Early on with young athletes, we see a lot of just shoulder strains where they're putting too much stress on the shoulder, and it really throws up the mechanics of the shoulder. So I'll see some abnormal movements. You'll see the shoulder blade winging out in certain areas, which are things that are correctable with the right therapy. As people get older, we start to see more rotator cuff problems, which is one of the most common injuries I probably see. It's extremely common for just overuse injury. A lot of people that do jobs that are laborers or any kind of overhead activity, a lot of times will develop some kind of shoulder trouble later in life.
Yeah, and is that something that physical therapy can remedy? Or?
Yes, yeah. So most of the time there are simple solutions. A lot of people have this fear that if they come to see us, it's going to be surgery right away. But most of the time you can fix these things with simple solutions, which is, some activity modification, some anti-inflammatories, and then working with a therapist to be directed on what exercises you need to do.
Now, when you talk about, other kinds of injuries that you see athletes have, what else is there? I mean, that's when you talk baseball and things like that. We think about their arms. But what else
right now we're in the middle of, baseball season, so that's what I see a lot of now is the shoulders and the elbows. But it really, depending on whatever sport it is, if it's runners, we see a lot of the, tibial stress syndrome, which are your shin splints, for example. A lot of foot and hip injuries that are just overuse that we have to kind of, give people realistic goals and understand that you can only push yourself so hard. Your body can only take so much, and it really varies sport to sport. But we see all kinds of different knee strains, and then most of the time it is not these big catastrophic injuries that require, surgery or big things. I just have to kind of guide them on, take this much time off, modify your activities in this way, and if I think it's helpful, I'll send them to therapy to work on strengthening the right muscle groups to help them get back to playing.
All right, talk about the weekend warrior, because we know they're all out there.
Yeah.
And they're all trying to, play a pickup basketball game or softball on a Wednesday night, something like that.
And I'm guilty of that. I'm one of those weekend warriors now. So I love to exercise. I work out every day, and I go to a gym with a lot of the crazy fanatics for working out. And it's great for your body. It's great to stay in shape. But, as we get a little bit older, things start to hurt. And there's some of my most challenging patients, because, once again, you're trying to find that balance. If you tell those people the last thing they want to hear is that they can't go to the gym and do their workouts, they can't run, they can't lift, and so you just have to find the sweet spot. And like I said, sometimes I can guide them and say, you injured this muscle, this tendon, and if you just avoid these activities for a period of time, take these anti-inflammatories, work on these exercises instead, we can get them back and keep them going while we allow them to heal at the same time.
All right, before I let you go, I have to ask you how tall you are.
6'7".
6'7". What did you play on a football field at 6'7"?
So I was a defensive end when I played, and I was 50 pounds heavier at that time.
Oh my gosh.
And I tell people I still wasn't big enough for Ohio State standards.
Oh,
so
my
I
gosh.
was a career backup. Yeah.
All right. Well, Dr. Brett Daly, thank you so much for coming by today. We appreciate you stopping in. Thank you. All right. We are here at OMNI Orthopaedics on Belpar. It is our Health Week on 1480 WHBC.